Hi, in this video we'd like to talk about a specific symptom that is very common for Hyperemesis gravidarum patients, which is dry retching or dry heaving. Now this form of vomiting is very similar to vomiting, but there's no exit of any type of substance for this type of patient. It's very specific to HG because it's slightly different than normal dry retching, because that is usually very temporary and treatable with just anti-nausea medication. However, dry retching of a hyperemesis nature is very different because it's very consistent. It happens violently and very persistently as well, because it can occur throughout the entire pregnancy period, thus affecting your food intake because you're unable to actually eat anything, not even drink anything, causing severe loss of weight, no lack of any nutrients, vitamins. This can lead to a potential preterm birth if you're lucky, or a potential stillbirth. Then that's a tragic, unwanted pregnancy loss that can be prevented if you seek the proper treatment, especially here at Antai Hospital, where we can entirely treat your Hyperemesis gravidarum. So dry retching, this condition is when you're constantly having the feeling of vomiting, and it's usually accompanied with severe nausea. Now here at Antai Hospital, we do know that the presence of ACG is actually causing this Hyperemesis gravidarum reaction, and these patients who develop HG, they have abnormal receptors that react to ACG. So the vomiting is actually caused because the vomiting center in your brainstem has these receptors, and they bind with ACG, causing a chain reaction and sending signals to your gastrointestinal system, causing it to actually vomit non-stop, to regurgitate whatever contents of the stomach it is, and it can be potentially violent as well. It can lead to blood and bile as well. So it's not uncommon to see the vomiting of blood, but usually it begins with dry retching, the feeling of vomiting. And this can actually lead to another common symptom, which is heartburn, because the esophagus is constantly spasming, contracting and then releasing, contracting and then releasing. This is actually caused by the synapses from the vomiting zone in your brainstem, caused by the abnormal receptors binding with ACG. Now when they are constantly spasming, the stomach acid is actually coming up and going down, coming up and going down. Each time it goes up higher and goes down, and this acidic liquid secretion mixed with bile, other forms of quite acidic substances are actually accumulating in your chest area. You feel heartburn now, but nothing is actually coming out, and that's called hyperemesis induced dry retching. And then this you feel a sharpness in your chest, you're unable to actually eat any type of food, and you feel heat as well. This is how heartburn begins with hyperemesis, and eventually once the dry retching ends, then the vomiting comes as well. The nausea gets more intense, leads to severe starvation as well, because you're not able to eat and drink, and this can definitely cause some form of effect to the baby, because you're losing weight and the baby is not receiving its nutrients. It is a miscarriage waiting to happen if you do not find any type of a supplement to actually retrieve all the nutrients that you need. But it's not that easy to tell women to actually start eating and start drinking, because they're unable to do that. The constant spasming of the esophagus and the gastrointestinal system secreting non-stop stomach acid, bile to actually just push food out, all of it is caused by this chain reaction of these receptors and ACG. So for this dry retching, to actually effectively overcome it, you may try all forms of anti-nausea medication. You find it to be not really helpful. It doesn't seem to work because it does not deal with the root cause. You need to figure out a way to actually stop the ACG and the receptor reaction, and which is why our HG vaccine, our ACG desensitizer, which is our proprietary medication here at Antai Hospital, is very effective in dealing with the underlying root cause. You do not need any other supplementary medication or drugs, injectables. Our HG vaccine alone, once administered, the reaction is actually quite observable. First thing that you observe is that the vomiting ceases, because these receptors are actually blocked. And once they are blocked, ACG is unable to bind with them anymore. So there's no contact and there's no synapses. So there's no contractions of the esophagus and there's no secretions of the stomach acid. And for the first time, you will actually experience relief. You're able to eat. The same thing happens when the pregnancy ends during hyperemesis. That's why you feel relief when pregnancy ends and you're able to actually smell, eat, taste again. The same thing happens again because there's no more ACG in your system. The placenta has exited your body. The pregnancy has exited your body. ACG is actually dropping steadily now, and then there's no more binding happening. So that's why you feel immense relief. This can actually be done before pregnancy, even during pregnancy with our HG vaccine, the exact same mechanism. Either you remove the receptor component or you remove the ACG component. But ACG cannot be removed unless you go into labor or the pregnancy ends in a miscarriage. In a state of extreme depletion, and any more longer that you stay in this state, the higher the chance for miscarriage. So firstly, at Antai Hospital, we do need to support you with some IV drips to get you stable at least. And then we follow up that with our HG vaccine. And very quickly, within a week, we begin to actually restore your appetite, restore your ability to drink, and you can gain your weight back. And no longer will you suffer the constant etching and the vomiting and the nausea, and you can actually enjoy your pregnancy this time. So please get in touch with us to find out more information about HG vaccine, our Hyperemesis Gravidarum ACG desensitizer. It is easily administered, easily received by our patients. Once you visit our hospital, we welcome all HG patients from all over the world. If you'd like to talk to our doctors or prepare an online consultation, please visit the website and contact us via WhatsApp. And please leave me a comment down below as well. Stay tuned to the next one.